And while some patients are being sent to Boise, travel nurses from Boise are going to the Magic Valley to help with the heavy workload there. Our Frankie Catafaias checks in with the doctor who oversees St. Luke's operations in the Treasure Valley to see how the whole system is handling the load.
I mean, we are seeing some real increases in our volumes here in the Treasure Valley as well. It's not as much COVID as what they're seeing in the Magic Valley, but volumes are still high.
COVID is only complicating what Dr. Johnson calls a busy time of year for hospitals.
Communicable diseases are transmitted more frequently. That aggravates people's underlying health conditions.
While hospitals in the Treasure Valley are not at capacity, Dr. Johnson is still concerned with COVID trends locally.
With COVID, there's a delay in the effects that we see on our hospital systems and on our other capacity to care. It takes about 2 or 3 weeks before we really start seeing those effects.
In a medical situation like this, St. Luke's has categorized care in 3 levels: standard, contingency, and crisis. Right now, the Treasure Valley is operating at the contingency levels of care.
Which is when we can provide the same level of care, but we're having to use some different strategies and structures. Things like our telehospitalists, remote monitoring, sending different staff to different facilities, trying to increase the number of patients who can leave the hospital earlier using remote patient monitoring.
Dr. Johnson says the Treasure Valley has a ways to go before reaching crisis care.
Crisis standards of care is really when everyone in the state is beyond capacity to care. We have no further ability to provide supplies, staffing, or facility spaces to provide care for people who would show up.
But keeping in mind the delay and effects COVID has within the community, it's important to continue hand washing, mask wearing, and social distancing.
We are at a risk of really seeing some difficult decisions having to be made when it comes to caring for people, because we may not have the capacity to do that if the trajectory continues. Making those changes now when we're not in that red alert phase is really important. And if we're going to get ahead of this, it just has to be done now.
For Idaho News 6, I'm Frankie Catafaias.
Got to make that change. St. Luke's is also encouraging anyone needing care for a medical issue to come to their hospitals. Dr. Johnson says they have not had a patient in their hospital contract COVID from another patient and/or staff member.